Hi, what is the difference between the seizure and the epilepsy? Are they the same or the different? If you have seizure, are you having seizure or epilepsy? There is abnormal activity in the brain leading to abnormal movements of the body, like shaking of one side of the body, sometimes fear, sometimes anxiety, sometimes numbness, tingling, frothing from the mouth, vomiting, unconsciousness. There's some symptoms of seizure and epilepsy. So there are so many different type of seizure, and all depends on the brain that is involved. It is the kind of turning switching it to. It is not necessary to make the diagnosis. So we have some epilepsy with completely normal EEG and MRI, and all the tests can be normal. Actually this happens a lot, even like more than half of the time. How we can treat the epilepsy? First, the seizure were provoked, and simply as stop the provoking and often fact that can stop this those seizure, which is because of some. We can treat a seizure and epilepsy. First, the seizure were provoked as simple as stopping the provoking and offending factor that can stop those seizures from happening, like quitting the alcohol and stop like drugs which can cause seizure. You need some medication for epilepsy and to need to treat the seizure also, and to the basically treatment of epilepsy. And luckily of the time the seizure that are the medications about 50 to 70% of the time, and sometimes we need seizures that are stubborn and to treatment, and they are called drug resistant and epilepsy. You must order treat to cure it and to learn to how to avoid. It's important to remember that epilepsy is a clinical diagnosis, means that it is based on the description of the event and how the patient had that event and the seizure and the clinical conditions, evaluations of the clinical or the neurologist, and the testings like EEG and MRI can support the epilepsy, but it is not necessarily that make the diagnosis. So we have completely normal EEG with patient with the seizure or epilepsy may have normal reports. So how we can treat the seizure patients? Seizure can provoke. It happens like it is doing it will manifest as a seizure. 1 in 10 people will have seizure once in a lifetime, and not necessarily as diagnosed as epilepsy. Some patient will tell that I only have a seizure, but it facts might have epilepsy. It is a kind of, there's some confusions and that concept of the seizures. Provoke means there is a stress in the brain, and on the brain that can include some symptoms like stress in the brain, and sometimes some conditions like, so example, they have overdrink and immediately they have stopped, all of a sudden stopped drinking. The withdrawal seizure may be happen to that patients. They may hit to the head. There some trauma in the brain. They also call may cause seizure. So CV also may cause. Family member and the loved ones have the epilepsy. He or she should know about what to do at the time of epilepsy or the seizure. If someone in front of you having a seizure or epileptic attack, you keeps your, don't pressurize, don't create any panic, keep the things away, sharp things away from the patient till the seizure stop. Remove the glasses, remove the scarf, remove the tie, remove all the sharp objects which are can harm the patient, so the patient may not get hurt. Keep the patient aside. Any saliva or any secretion will come out, and that can prevent the choking. Give some soft pillow to the patient for the head, so that this will prevent the injury. Generally seizure activity will stop automatically, so don't try to stop it, and don't create any panic. Queries or any information regarding epilepsy or the seizure or any other disease, you can call me on my number 855 88 77874. Thank you.